So, this is Monique Redmond, and I will be presenting a presentation on FAS or fetal alcohol syndrome. As you can see in the picture, there is a young woman that's with child, obviously with child, and is consuming an alcohol beverage that looks kind of like a beer. And let me start by saying there is no known safe amount of alcohol to drink during pregnancy. Any amount of alcohol can harm a developing fetus and increase the risk of miscarriage. And alcohol easily passes through the placenta, which is the organ that nourishes a baby while the mother is pregnant. Alcohol exposure during the first trimester, perhaps before a woman even knows she is pregnant, can cause major birth defects. Later in the pregnancy, drinking alcohol can cause poor growth and brain damage that could lead to learning and behavioral problems. These problems can be prevented by not drinking any alcohol at all during your pregnancy. If a woman thinks she may be pregnant or trying to get pregnant, she should not consume alcohol. So, what is fetal alcohol syndrome or FAS? Again, as I stated previously, that babies are exposed to fetal alcohol syndrome while in the womb through the placenta. Fetal alcohol syndrome is considered to be a leading cause of developmental disabilities of known causation. It is the most severe condition amongst a group of conditions. So, out of all of the fetal alcohol spectrum disorders, fetal alcohol syndrome is the most severe. It is the number one cause of mental retardation in the United States, the only preventable cause of birth defects. How do you diagnose fetal alcohol syndrome? To diagnose it is basically based on symptoms that doctors look for, which we'll get into that further into the upcoming slide. Fetal alcohol syndrome is associated with behavioral and intellectual disabilities. It affects range from mild to severe depending on the individual. So, and just continuing from the previous slide, children with fetal alcohol syndrome have multiple handicaps, but all babies that are affected by alcohol exposure before birth do not have symptoms associated with fetal alcohol syndrome, but they do have brain damage and other defects. So, ARND is an alcohol related neurodevelopmental disorder, and babies that are or children diagnosed with ARND suffer from function or mental impairments which are directly linked to being exposed to alcohol while the mother was pregnant. ARBD, which is alcohol related birth defects. Babies or children suffer from malformations in the skeletal and major organ systems. So, how do you identify fetal alcohol syndrome, or how does a doctor diagnose fetal alcohol syndrome? So, the doctor has to look for certain symptoms to diagnose fetal alcohol syndrome. So, some of those symptoms would be abnormal facial features like a smooth ridge between the child's nose and upper lip, them having lower than average height and weight or both, central nervous system problems such as being born with a small head size, them having problems with attention and hyperactivity, poor coordination, and um, knowing that the baby was exposed to alcohol during pregnancy is also a way to diagnose, but it is not required to confirm the diagnosis. And some children suffer with milder symptoms, so it's harder to diagnose them with fetal alcohol syndrome. So with this slide, I wanted to provide a photo of some children that were diagnosed with fetal alcohol syndrome. And by their facial structure, the way their eyes are shaped, you would think that they were diagnosed with Down syndrome, but they are not. They were diagnosed with fetal alcohol syndrome. So they have some similar characteristics in terms of appearance when it comes to children that have been diagnosed with Down syndrome. So let's discuss some behavioral characteristics for children that have been diagnosed with fetal alcohol syndrome. And I've listed some bullet points here. But children with fetal alcohol syndrome tend to be very outgoing and socially engaging. Unfortunately, even though they are outgoing and very social, they are seen as others as intrusive, not knowing when to stop talking. They are unaware of social cues and conventions. They have poor social judgment, poor socialization skills. They're hungry for attention, whether it's negative or positive. Due to their social immaturity, they have difficulty establishing friendships, especially with children of the same age. And I will discuss that detail later on in the presentation a little further as to why they have difficulty establishing friendships with children of their at the same age as they are. Something else that is important is the potential for both social isolation and exploitation of children diagnosed with fetal alcohol syndrome. Because they are very outgoing socially, and they often show socially inappropriate behavior due to their impaired practical reasoning skills. As a result, they may not be able to consider the results of their actions. Um, Children with fetal alcohol syndrome can be easily influenced by others because they're very trusting. They have a very trusting nature and they are eager to please, and they can be randomly attracted to strangers. Again, which why I said previously, it's very important to note that it's very evident with children who are diagnosed with fetal alcohol syndrome, the both social isolation and exploitation. It's very evident. Now let's discuss some learning difficulties. Children with fetal alcohol syndrome frequently have learning disabilities, which is a direct result of poor thinking and processing skills. Information may be known, but cannot be applied to different situations. Learning may occur in spurts. Easy learning periods may be followed by harder ones. During difficult periods, children may have trouble remembering and using their learned information. They could have some learning difficulties could be developmental delays, attention deficit, poor organization skills, difficulty with abstract concepts, speech delays, stuttering and stammering, difficulty learning cause and effect, poor mathematical skills, problem with memory, difficulty learning from past experiences. And because they are inconsistent in learning, the teachers may think that they are just not trying. And this could cause for the child to be labeled as being lazy or stubborn. Um, this slide is basically discussing, it's basically providing bullet points on what I touched on earlier about the developmental delay with children diagnosed with fetal alcohol syndrome and why they have difficulty making friends with children of the same age. So a child that's 5 years old would have difficulty establishing a friendship with another 5-year-old because even though they are five, developmentally they are only two. And a child that's 13 is developmentally 8. So they would have difficulties establishing those friendships with children of the same age group. So now let's discuss living with fetal alcohol syndrome. Once you're diagnosed with it, now what? There is no cure for any fetal alcohol spectrum disorder, which would include fetal alcohol syndrome. Research shows that early intervention can improve the child's development. There are many treatment options. There is no one treatment that would help for each and every child. There is no right treatment for each and every child. Each child is different, um, and different treatment options, different medications would help with different symptoms, again, depending on the child. And there are a number of factors that can help reduce the effects of fetal alcohol spectrum disorders and help people reach their fullest potential. So there are various treatments out there that, can help children diagnosed with fetal alcohol syndrome. There's speech, occupational, and physical therapy, early intervention education services, adult classes to help the parent or caregiver handle problem behaviors or other issues. There are social skills classes for the children diagnosed with fetal alcohol syndrome, counseling with a mental health professional for the child and also for the parent and or caregiver. There is some medication prescribed by doctors for fetal alcohol associated problems. There is also alternative treatment like biofeedback, yoga, creative art therapy, herbal supplements. Some may be helpful, especially using relaxation techniques for anxiety. Others have not been tested and may be harmful. So it's important to check with the child's doctor before starting any alternative treatment. So let's discuss some educational needs for the different stages. And even very young infants can benefit from early stimulation programs to help with intellectual and motor development. Preschoolers often have a range of developmental and language delays, as well as signs of hyperactivity, irritability, and distractibility. Preschool programs, which follow individualized educational plans, are helpful for the child as well as for the parents who gain valuable respite time to regroup from the intense demands of these children. Appropriate placement in special education classes beginning in elementary school is often necessary for children with fetal alcohol syndrome. A small classroom setting with clear guidelines and a great deal of individual attention can maximize the intellectual capabilities of these learners. Although intensive remedial education has not been shown to increase the intellectual capabilities of children with fetal alcohol syndrome, it may prevent further deterioration. Now let's discuss placement of the child with fetal alcohol syndrome in the classroom. So you would want the child to sit near the teacher or in an area that's associated with instruction without excluding them from the regular class setting. Um, their seat, however, should be in an area where the rest of the students are not directly in the line of vision of the student with the fetal alcohol syndrome. You would want them to sit near other students in the class who are perceived as positive role models and who aren't easily drawn into negative behaviors to sit close to the student. The teacher will want to limit distracting stimuli, which would be things like visuals, posters, to prevent them from becoming overly stimulated and restless. Distracting stimuli can also be smells from the lunchroom, a high traffic area, heating or noisy air conditioners, the doors, and the windows. And the teacher also wants to have an area in the classroom for when the child does become overstimulated. Make sure that area has some headphones to block out the distracting noises, or for them to be able to listen to music, which could be soothing to some of the students that are diagnosed with fetal alcohol syndrome, or even pictures, relaxation techniques through pictures for the student to refer to. So, strategies for fetal alcohol syndrome parents and or caregivers. So, what we want to do is follow a model of structure, consistency, variety, brevity, and persistence. So, because they lack internal structure, the parent or caretaker will need to provide external structure for them. It is important to be consistent in response and routine so that the child feels the world is predictable. Because of serious problems maintaining attention, it is important to be brief in explanations and directions, but also to use a variety of ways to get and keep their attention. Finally, we must repeat what it is we want them to learn over and over again because, as I stated previously, many children with fetal alcohol syndrome they have difficulty structuring their work time. They show impaired rates of learning, experience poor memory, act impulsively, exhibit reduced attention span or are distractible, cannot handle money age appropriately. They may have differences in sensory awareness, hypo or hyper. They show poor problem solving strategies, language production higher than comprehension. So, some effective strategies would include fostering independence in self help and play. Giving your child choices and encourage decision making, teaching them daily living skills, encouraging them to use positive self talk, having the child get ready for the next school day before going to bed, establish routines so the child can predict coming events. For unpredictable behavior at bedtime, mealtime, establish a firm routine. Break their work down in small pieces so they don't feel overwhelmed, and give them choices and encourage decision making. So let's talk about some discipline when dealing with children with fetal alcohol syndrome. Sidebar, children in general. But no, discussing discipline for children with fetal alcohol syndrome. It is important to be consistent. Set limits and follow them consistently. Avoid situations where the child will be overstimulated. There must be consequences for negative behaviors. It's okay to reward and change them often to keep the interest in the rewards so that they expect they're going to be rewarded for, the positive behavior they've displayed or positive changes that they've made. Intervene right away before the behavior escalates. Um, Recognize the good behavior, as I said previously about the rewards. It's okay to reward. Stop with the threats. Avoid threats. The rules have been established. Just do it. Don't debate. Don't argue. Don't threaten. Just do it. The rules have been established. Pre-establish consequences. Um, Notice another thing about recognizing the good behavior is noticing and commenting when the child is doing well or behaving appropriately. Protect them from exploitation. And again, that's another one that's important because, as I said previously, because they are so outgoing and so trusting and easy to be attracted to strangers, they are highly susceptible of being exploited. It's very important to protect children with fetal alcohol syndrome from being exploited. So, transitioning from a child with fetal alcohol syndrome to an adult with fetal alcohol syndrome. As I stated very early on, there is no cure for any fetal alcohol spectrum disorder, which includes fetal alcohol syndrome. And as I said earlier on, that fetal alcohol syndrome is actually one of the worst conditions to be diagnosed with. So, children, the child with fetal alcohol syndrome, family and/or caregivers will face additional difficulties. Children who have fetal alcohol syndrome and who are in the last year of middle school or in the beginning of high school are in need of a transitional plan. This plan has to cover their high school years and the transition period to life after it. So it's extremely important for the child to be diagnosed with fetal alcohol syndrome so they can be covered under IDEA. Um, One of the issues, even among those who do recognize fetal alcohol syndrome, the focus is more on children than adults with the disorders. As individuals with fetal alcohol syndrome enter adulthood, they and their family members and caregivers face additional challenges. Adults are increasingly vulnerable to the secondary disabilities associated with fetal alcohol syndrome, like being in trouble with the law, mental health problems, the inability to live independently, and victimization. The adults are more likely to be unemployed and often struggle to manage money in their possession. While a proper diagnosis, access to the best interventions, and a positive environment are beneficial, they often do not prevent secondary disabilities. Um, Again, as I said previously, it is important to try to have this caught early on and diagnosed so that they can receive the care and attention, education, help that they need, starting early on to be covered under IDEA. Uh, Children and parents dealing with the problems of fetal alcohol syndrome need strong advocates. The need for advocacy is very important as fetal alcohol syndrome is a lifelong disability. Advocacy must come from both the parent and or caregiver and the professional involved with the child. Despite the many problems that the children with fetal alcohol syndrome face, they have a great capacity for love and contribution to family and the community. The challenge of caretakers and service providers alike is to help these children harness their potential and find their place in the world. Again, I can't stress how important it is. The need for advocacy is so important for these children who have to unfortunately deal with a lifelong disability for a disabling disorder that could have been prevented. And the last page are my references, and hopefully I did well. You like my presentation. I covered all areas. Good night.